Hello, I'm Dr. Greg Fors, a board-certified chiropractic neurologist, certified in applied herbal sciences, and in acupuncture. I'm trained through the Autism Research Institute, and I'm a registered Defeat Autism Now doctor and clinic director of the Pain and Brain Healing Center in Blaine, Minnesota. I'm also author of the best-selling book, Why We Hurt and How We Heal. This book has done tremendous as far as helping many people, even around the world. Why We Hurt is an excellent book as a reference guide for many of the disorders that we're talking about in this video series. Also, as an international lecture to doctors and the public, I get asked many questions. One common question is, why the big increase in autism, ADHD, asthma, and allergies, known as the Big Four? Well, it turns out that now more than up to 1 in 2 children are now affected by one of these disorders. Every 20 minutes, a child is diagnosed with autism. The CDC now reports that 1 in 91 children are autistic. Every 2 minutes, a child is diagnosed with ADHD. The rate of ADHD has now reached levels of 1 in 10 children. So, this tragedy is growing even more frightening in the fact that 1 in 6 infants now have developmental delays. Childhood depression is now epidemic in the U.S. according to the World Health Organization. And no, this is not because of greater awareness or better diagnosis. That is a coward's way out of the tragedy that we are now facing as a nation. A recent study, which was just completed, was measuring the amount of industrial chemical contaminants, actual industrial chemicals, in the blood of newborn infants. By taking samples of umbilical cord blood, they measured for 413 toxic chemicals. Out of this, 287 chemicals were found in these newborns, ranging from 154 to 231 chemicals per child. Of this chemical soup, 287 of these chemicals and 180 of these chemicals, out of these 287 chemicals, 180 of them are chemicals known to cause cancer. 217 are known toxins to the brain and nervous system. Is there any wonder why we're seeing so many developmental issues in brain and nervous system health? And 208 of these cause developmental problems in children. These chemicals have been found in our world. They're now found in our world just a little over 60 years. It's only been 60 years since we've introduced this into our environment and into our bodies. And this exposure is getting worse. Everyone now agrees that our diet has become one of processed, devitalized foods. Is it any wonder why we're seeing so many health problems in children today between the chemical exposure, processed foods, devitalized soils, nutritional deficiencies? This is forming a destructive storm that is washing over all of us, but affecting children to a greater degree. Children are smaller and have a faster metabolism, so they are much more endangered to this sort of nutritional deficiencies or chemical exposures. This is the reason we're seeing so many different issues developing within the childhood. However, there's much that you can do to help your child recover. This is the primary focus at my clinic, the Pain and Brain Healing Center. Children can recover naturally from autism, ADHD, asthma, and allergies. I see it every day in our clinic. You must take responsibility to stop this cumulative poisoning of those you love so dearly, your family. For if you do not do it, who else will? One approach that is gaining ground is a natural biomedical approach for children with autism, ADHD, behavioral problems, asthma, and allergies. A biomedical care for these disorders is a science-based metabolic approach to treatment. Everyone agrees that drugs do not heal the problem, they simply reduce or suppress some of the symptoms. Wouldn't it seem better choice to address the underlying metabolic issues, the health problems that are affecting the child? My primary guiding principle is very simple. This biomedical approach is the 3 R's of removing what is causing harm. In other words, chemical exposure, toxic metals, or something known as gastrointestinal endotoxins from imbalanced proper bacterial growth in the gut. Also, restore what is missing. That's the second R. We want to restore nutrients, maybe probiotics to help balance the gut flora, certain specific nutrients that are needed for good, healthy brain function. And then repair what is damaged, the neuron cell membrane, gastrointestinal tract. Whatever we find damaged, we then optimize its function by providing the necessary nutrients needed for that child to heal. Care at my clinic is different. I utilize a step-by-step approach to promote real healing. First, a comprehensive review of your child's health history is completed. along with a thorough neurological exam. Second, based on this, specific laboratory tests through blood, urine, and stool are performed to rule out any pathology and provide vital clues on what road to take to optimize your child's body and brain health. Third, problems with maldigestion, malabsorption, leaky gut, dysbiosis are identified through specific laboratory tests such as digestive stool analysis and urinary organic acid profile. Then they are addressed through proper approach. Many times we'll look at an IgG food allergy blood test, which will help us identify any food allergies that may be affecting your child's overall health. At this point, a specific diet and supportive nutrients are put together as a specific program for your child, depending on what's found on history, exam, and clinical lab results. Once we put this program together, this biomedical program, we then help you implement it in the easiest way. Because many times it is difficult to get nutrients into your child, so we utilize different liquids or powdered vitamins, minerals, herbs, different things that make ability to much easier to provide them for your child. Then sometimes we go on to toxic metal testing. Testing for lead and mercury, which you've probably heard of. We have a great deal of exposure in our environment to these heavy toxic metals. So many times these need to be chelated out. And this we do after we've done more healing as far as the GI tract and the overall health of the child. Then they're ready for the chelation. So what are you waiting for? When so many children have already found recovery, you want the very best for your child. It may take some time, effort, and money, but you can optimize their brain health, their brain function. Imagine how you'd feel hearing your child carry on a conversation if they're not verbal right now. How proud you'd feel seeing them mainstreamed in school or graduating even from high school and going on to getting married. Imagine how that'd feel. This is what is possible through a biomedical program. What would it be worth to you? Call our clinic today at 763-862-7100 and see how easy it is to get started. Thank you.